Hello everybody, my name is Brian Bowen. I'm on the Vitality Health team with Renewed Vitality Health and Wellness. I am a licensed acupuncturist, a manual therapist, and a postural alignment specialist. I'm here today to bring you one of first of many tips for health and wellness. Today we're going to be talking about joint mobilization and mobility, and I'm going to show you a simple technique to keep the proper range of motion in all of your joints. This is for any age group. It's great to do in the morning and before you go to bed. To help minimize the wear and tear on your joints. This is one of the first of many tips coming to you. Also, if you happen to be a health and wellness professional in any field and would like to submit a video to put on the blog, please contact us at renewmyhealthnow.com, and the contact information is on that page. So the first thing we're going to go through, I'm going to scoot back to make sure everybody can see here, is this is called 7 series joint release. Throughout the day we get wear and tear on our joints. Joints get out of position, which cause more wear and tear. We get muscular imbalances because of that. So today is about putting the joints in the optimal position and kind of rebalancing the musculature around those joints. So the 7 series joint release, we're going to start with the feet. And so the feet's the foundation. It looks a little goofy, so some of you might not want to do this in front of your coworkers. For those of you who really don't care, I say go for it because it's fantastic, especially if you're sitting down all day. It's going to help prevent a lot of problems. So starting with the foundation, building our way up, we're going to put our feet together, then put your hands on your knees, okay? So depending on how healthy you are, depends on how big of a circle you're going to make and how fast you go. So please listen to your body. This is one of the important things that we're trying to teach, is start to create body awareness for each individual, one individual at a time. So we're going to put our feet together, put our hands on our knees, and we're going to go in a circle one way. Let your knees bend. You're going to let your hips kind of move with the knees, let the natural fluidity kind of come out in the hips, and make as big of a circle or as small of a circle as you feel comfortable or that you don't have joint pain. And so you're going to do nice circles one way, complete. Really working the ankles, the feet, the knees, and starting to migrate up into the hips a little bit. After you do that one direction for a little while, now feel free to go longer than I am just for the video to keep it short and simple. We're not going to do a full 3 minutes or anything like that. So it's up to you. You'll feel some popping. Depends on your knee joint, so kind of work through that. Don't push through pain or create too much pain, but once you feel like they've created or got to a maximum balance point, then reverse it and start going the other way. Really helping the ankles rearticulate where they're supposed to be. The tibia and fibula is supposed to be sitting on the ankle bones itself, and letting the knees kind of rearticulate, letting all the ligaments kind of stretch out and the muscles kind of balance around the joint. So that's 1. 2, our feet go about shoulder width apart. This one looks really funny. The more fluid you can do this, the better condition your hip joints are in. The stiffer you look, the more tightness there is around the joint with the muscles. So don't be shy, let it go. On this one, feet shoulder width apart, I like to put your hands on the iliac crest, this bone right here, and your thumbs touching the top of the SI joint right at the 5th lumbar vertebrae. This way it helps kind of your own biofeedback. Kind of helps you feel the movement in the SI joints and the L5, S1. So you should feel that kind of moving around. So I'm going to face this direction again. So hips here, hands on your hips, feet under your shoulder, and you're going to do alternating knee bends. So you're just alternating your knee bends, and you're letting your hips move with the knees as they bend. So as this one comes back into full extension and this one flexes, you're going to get a little torsion and a little opening on the SI joints this way. Then you're going to go back the other way. So you just do a little alternating knee bend. And if you can get this down, you can do some great disco moves later. So feeling that SI joint opening, and keep doing it till you really feel those SI joints open. It's really great for those of you who have lumbar pain, SI joint pain, feeling stiff in the morning, and kind of as you get up and moving around, it starts feeling a little bit better. So you're alternating knee bend. So we're working our way up. Now we're getting more movement. We're still getting movement and flexion and extension of our ankles, flexion and extension of our knees, our hips, kind of creating a great kinetic chain, and letting those hips free, freeing them up. And now we're getting into our low back a little bit more. All right, after that, none of the guys like this, so you're going to widen your feet just a little bit more. Keep your hands on your hips, kind of so you can feel the motion, and you're going to do the hulas. This is awesome for low back, hips, getting into the knees. And again, the more fluid that it feels and looks, the better it is. And go as fast as you want or as slow as you want. Listen to your body. So if you look like this, you're really tight. So try not to judge yourself. Just let it go, and who cares what other people think. So nice circles one way. Then after that, reverse it. Go the other way. And even let it kind of move in your mid-back and let your shoulders kind of move a little bit. Don't hold really rigid and hold your neck tight. So that's 3. The fourth one you want to be really careful with. So for those of you who do have chronic pain in your low back or degeneration, be safe with this one or cut this one out of the series. So you're going to go a little wider with your feet, wider than shoulder width. You're never going to go back. That's the most important thing. Never extend backwards. So it's kind of like a half moon. So you go to the side, dip and round your back over to the other side, and then when you hit here, and don't go back this way, stop here, this is the midline, and then you're going to come up and over. So up and over, like so. And again, as slow as you want. If this one, you might want to really go slow and really be cautious. Work your way through, listening to your body, and then once you get that down, reverse it. Good. Good. So that is 4, I believe. So now we're going to move up our back more. So we're working our way up the spine, so up into the mid-back a little bit more. And this starts getting the wrists, elbows loose, the shoulder joint loose, still getting low back through rotation, getting the mid-thoracic spine between your shoulder blades, starting to get up into your neck a little bit. So this one you're going to go wide, keep your hands and arms loose, keep them sloppy and flappy. And so you're basically going to hit yourself, so this is the only time I'll ask you to do that, in a loving and kind, caring way, of course. So you're going to move, the movement initiates from the hips, kind of like in martial arts. So you're going to kick this hip here. When you do that, let your spine be free, and let your shoulders and everybody move with it. In some Qigong, they'll use this for getting the kidneys, hitting the kidneys with this hand. Kind of waking the kidneys up, getting that kidney Qi moving, your kidney energy. So you're going to go back and forth. So you should hear that slap. A lot of people hold their shoulders too tight, and people with really tight shoulders and even up into the neck, you'll notice they'll just kind of do this, and they really can't let that arm swing around. So again, the more fluid you are, the more you'll hear the sound. All right? So moving up into 6, we're going to do alternating shoulder rolls. This starts loosening the shoulder girdle and all the muscles, the trapezius and levator scapula and such forth that come from the neck down into the shoulder girdle. And so what you're going to do, back to shoulder width apart, standing nice and tall, ear over shoulder, over hip, over knee, over ankle. And you're going to alternate this, or rotate your shoulders this way, kind of alternating. Nice big circles. This will start even loosening up your ribs a little bit, which everybody needs because we don't breathe deep. And you can go faster if you want, or take it nice and slow. This one, a lot of people get a lot of fun shoulder popping. A lot of times this joint doesn't articulate right, or this supraspinatus muscle is really tight. Rhomboids. So after you do that one, then reverse it. And go the other way. And you can smile while you're doing it too. Alright. So after you do that one, 7 is the cervical. So same thing as the low back one, never extend the neck backwards in this position, especially if you have any tingling down the arms or you have problems with your cervical vertebrae. Be careful with this one. You might want to either skip it or move a little slower and just listen to your body. So ear to shoulder, boom, around, chin to chest, ear to shoulder, and back over. So when you hit the midline, shoot back over, don't roll backwards. So popping over like that. And for those of you who don't have neck problems, if you want to move a little faster. And if you have any proprioceptive issues, do it with your eyes open. It feels good to do it with your eyes closed, but if you feel like you're going to get dizzy and fall down, I don't want any lawsuits. So you go that direction for a while, get some, feel your, some popping, a little, for some of you with tighter necks or arthritis, you might feel a little decrepitus, which is that gristly, crunchy, gravelly kind of sound coming from the neck. And reverse it and go the other way. And when you're done, finish up, and then you can shake it all out. So after a hard day of work and putting your body in compromised position and strain and stress, whether you're sitting at the computer and you're all hunched over all day long, or if you're a laborer and unloading trucks and loading trucks, this is a good way to rebalance the joints and helps the musculature balance from left to right and back to front. Also, if you get up in the morning and you're stiff, depending on your bed, if you have problems sleeping, this is a good time to do it in the morning. You can do it throughout the day, of course, too, and at night it really helps people sleep too. So I hope you've enjoyed the tip. Please check our website out at renewmyhealthnow.com and watch for more upcoming tips. I hope you enjoyed it, and if you want to submit a video for a health tip, please contact us through the webpage. Thanks, bye.